Welcome to our health series for seniors. As we age, our bodies become more sensitive to the foods we eat. Some foods that may have been fine in our 20s or 30s can now harm our heart, brain, or even our bones. In today's video, we'll dive deep into the top 10 foods seniors should avoid and why cutting these from your diet can make a powerful difference in how you feel every day. Before we start, meet Dr. Samuel Greene, a leading geriatric nutritionist with over 25 years of experience. Dr. Greene has worked with thousands of seniors around the world, helping them live longer, stronger, and healthier lives through smarter food choices. His insights today are based on science, patient experience, and a passion for elder wellness. As we age, our digestive systems slow down, our bones need more care, and our hearts need protection more than ever. Avoiding the wrong foods is just as important as eating the right ones. 1. Processed meats. Let's begin with a category of food that's extremely common, yet quietly damaging to senior health. Processed meats. These include foods like bacon, sausages, deli meats, and hot dogs. While they may taste delicious and are often convenient, they come with serious health risks, especially for older adults. Why processed meats are dangerous for seniors. Processed meats are preserved through smoking, curing, salting, or adding chemical preservatives like nitrates and nitrites. These additives not only help these meats last longer, but also make them harmful to the body, particularly in older adults whose organs are more vulnerable. Here's what makes processed meats problematic. 1. Excess sodium. Many processed meats contain up to 500 to 1,200 milligrams of sodium per serving, sometimes half a senior's daily recommended intake in just a few slices. Risk. High sodium causes fluid retention, increases blood pressure, and stresses the heart and kidneys. 2. Nitrates and nitrites. These are chemical preservatives used to keep the meat looking pink and fresh. In the body, they can turn into carcinogenic compounds, increasing the risk of colorectal cancer and other forms of gastrointestinal disease. The World Health Organization, WHO, classifies processed meats as Group 1 carcinogens, meaning there is strong evidence they cause cancer. 3. Saturated fats and cholesterol. Processed meats often contain high levels of saturated fat, which can raise LDL, bad cholesterol, contributing to atherosclerosis, stroke, and heart attacks. Seniors are especially at risk due to decreased metabolism and reduced organ function with age. I've seen patients go from daily bacon to plant-based proteins and notice better energy, lower blood pressure, and improved digestion in just a few weeks. It's not about removing joy from food. It's about removing the danger. 2. High sodium foods. Salt is a seasoning most of us have used all our lives. But what many seniors don't realize is how much sodium is hidden in everyday packaged and restaurant foods, even if you never pick up the salt shaker. Over time, that hidden salt builds up in the body and can quietly damage vital organs. Why high sodium foods are dangerous for seniors. Dr. Greene on camera or voiceover. Sodium plays a role in fluid balance, but as we get older, our kidneys become less efficient at processing excess salt. That causes fluid to build up in the bloodstream, making the heart work harder. Let's break down the major risks of high sodium intake in seniors. 1. Increased blood pressure. Hypertension. Sodium pulls water into the blood vessels, increasing pressure on artery walls. This is the number one contributor to strokes, heart failure, and aneurysms in older adults. Nearly 70% of adults over 60 have high blood pressure, often linked to salt-heavy diets. 2. Kidney strain. The kidneys are responsible for filtering sodium. Too much salt over time can lead to chronic kidney disease, especially in seniors with diabetes or pre-existing hypertension. 3. Bone health impact. High sodium intake causes calcium loss in urine, which weakens bones and increases the risk of osteoporosis, a major issue for seniors. 4. Water retention and swelling. Salt causes the body to retain water, leading to swollen ankles, puffy hands, and weight gain from fluid, which strains the heart and joints. I tell every senior patient, if you want to keep your heart beating strong and your brain sharp, start with salt. Reducing sodium is one of the fastest and most effective ways to improve your health after 60. 3. Sugary snacks and desserts. Sugar may seem like a harmless treat, something to enjoy in moderation, especially after a good meal or with your tea or coffee. But for seniors, excess sugar can quietly damage multiple systems in the body, from your brain to your heart to your immune system. That sweet tooth could be doing more harm than you think. Why sugary foods are harmful for seniors. As we age, our ability to manage sugar declines significantly. The pancreas produces less insulin, our cells become more resistant to it, and blood sugar levels stay high longer. That puts seniors at major risk for type 2 diabetes, fatigue, vision loss, and cognitive decline. Here's how sugar impacts older adults. 1. Increased risk of type 2 diabetes. Consistently eating sugary snacks leads to spikes in blood glucose, which over time can overwhelm the body's ability to manage insulin. Diabetes increases risk of heart disease, kidney failure, poor circulation, and even amputation in extreme cases. 2. Accelerated cognitive decline. Studies link high sugar intake to increased risks of dementia and Alzheimer's disease. Sugar causes inflammation in the brain and can interfere with memory formation and mood regulation. 3. Weakened immune system. High sugar intake reduces the effectiveness of white blood cells, making seniors more vulnerable to infections, slow healing, and illness. 4. Weight gain and fatigue. Sugar is full of empty calories, causing weight gain without offering nutrients. This extra weight strains joints, increases inflammation, and worsens arthritis. Plus, sugar highs lead to crashes, leaving you feeling more tired, foggy, and moody. 5. Dental issues. Seniors often face challenges with oral hygiene due to dry mouth or medication. Sugar increases the risk of cavities, gum disease, and tooth decay, which can affect overall health and even digestion. Sugar is one of the most addictive substances in the modern diet and one of the most dangerous for seniors. But the good news is, the moment you reduce sugar, your body begins to heal. Energy improves, weight drops, brain fog clears, and long-term health is protected. 4. Fried and greasy foods. There's something undeniably comforting about the smell of fried chicken or the crunch of hot, crispy fries. But while these foods may be flavorful, they're also among the most damaging to senior health, especially when consumed regularly. Fried and greasy foods are loaded with harmful fats and offer little to no nutritional value, putting your heart, liver, digestive system, and joints at serious risk. Why fried and greasy foods are dangerous for seniors. As we age, our metabolism slows down, our arteries stiffen, and our body becomes less efficient at processing fat. That makes fried foods especially toxic to seniors, even if you've been eating them your whole life. Let's look at what makes fried and greasy foods so harmful for the elderly. 1. Trans fats and saturated fats. Most fried foods are cooked in partially hydrogenated oils, which contain trans fats, the most dangerous type of fat for human health. Trans fats raise LDL, bad cholesterol, and lower HDL, good cholesterol, increasing the risk of heart attack, stroke, and clogged arteries. Saturated fats also increase inflammation, especially in people over 60 who already have chronic conditions like arthritis, diabetes, or high blood pressure. 2. Heart and artery damage. Regular consumption of fried foods has been linked to arterial plaque buildup, hypertension, and congestive heart failure. Seniors who eat fried foods 2 or more times per week are at significantly higher risk of cardiovascular disease and premature death, according to studies. 3. Digestive and liver issues. Fried foods are hard to digest. As people age, their digestive enzymes decline, making it more difficult to break down heavy, oily meals. This can lead to bloating, indigestion, acid reflux, and even gallbladder problems. Additionally, greasy foods put extra strain on the liver, which becomes less efficient over time. 4. Weight gain and joint pressure. Fried foods are calorie-dense but nutrient-poor. Even small portions can be packed with 400 to 800 calories and almost zero fiber. This leads to weight gain, which puts pressure on the knees, hips, and spine, a major concern for seniors who may already struggle with mobility, arthritis, or osteoporosis. I've seen countless seniors regain energy, reduce cholesterol, and even lose weight just by eliminating fried food. The difference it makes is incredible. And once they switch to air-fried or baked alternatives, they don't even miss the grease. Alcohol. Many people enjoy a glass of wine at dinner or a beer while watching TV. But as we age, the way our bodies process and respond to alcohol changes dramatically. Even small amounts can pose serious risks to senior health, especially when combined with medications or chronic conditions. Why alcohol becomes more dangerous. After age 60, as the body ages, its ability to break down and eliminate alcohol declines. The same drink that had little effect at 30 can be twice as strong at 70. Seniors have less water in the body, slower liver function, and increased sensitivity to alcohol's effects. Let's break down the key health risks alcohol poses for older adults. 1. Impaired balance and fall risk. Alcohol slows reflexes, weakens muscle coordination, and impairs balance, a dangerous combination for seniors already at risk of falls. Falls are the #1 cause of injury and death in people over age 65. Even one drink can increase the chance of a hip fracture, head injury, or hospitalization. 2. Memory loss and cognitive decline. Alcohol negatively impacts brain health, increasing the risk of confusion, delirium, and dementia. It can cause short-term memory loss and worsen symptoms of Alzheimer's and age-related cognitive decline. 3. Liver and kidney damage. As we age, the liver becomes less efficient, and alcohol is harder to metabolize. Chronic alcohol use, even in small daily amounts, can lead to fatty liver, hepatitis, or cirrhosis in seniors. It also puts pressure on the kidneys, which are already more fragile in older adults. 4th, interaction with medications. Alcohol interacts negatively with over 150 commonly used medications, many of which seniors rely on daily. It can weaken medication effectiveness or cause dangerous side effects, including increased drowsiness, leading to falls, internal bleeding, with blood thinners like aspirin or warfarin, dangerous drops in blood sugar in diabetics, increased toxicity of antidepressants, sedatives, and painkillers. 5. Heart and blood pressure. Concerns alcohol may temporarily lower blood pressure, but chronic intake leads to long-term hypertension, irregular heartbeat, AFib, and increased stroke risk. Alcohol is also a hidden source of sugar, contributing to weight gain and insulin resistance. 6. Raw or undercooked eggs and meats. Many people enjoy soft-boiled eggs, rare steak, or sushi. But for seniors, consuming raw or undercooked animal products poses a serious risk, often much greater than for younger adults. As the immune system weakens with age, the ability to fight off foodborne pathogens like Salmonella or E. coli also declines. In fact, food poisoning in older adults can quickly escalate to hospitalization or even be life-threatening. Why raw and undercooked foods are dangerous for seniors. In younger adults, the immune system can often handle small exposures to bacteria or parasites, but in seniors, the same bacteria can spread quickly and lead to severe complications like sepsis, kidney failure, or dehydration. That's why we advise seniors to avoid all raw or lightly cooked animal products. Let's take a closer look at the dangers. 1. Weakened immune response. As the body ages, the immune system produces fewer infection-fighting white blood cells. This makes it harder to fight off bacteria like Salmonella, E. coli, Listeria, and Campylobacter. These can cause severe diarrhea, fever, vomiting, and dehydration, dangerous for seniors, especially those with pre-existing conditions. 2. Greater risk of dehydration. Vomiting and diarrhea caused by food poisoning can quickly lead to electrolyte imbalance and dehydration, which can worsen heart conditions or kidney problems. Seniors often don't feel thirst as strongly and are more prone to dehydration to begin with. 3. Higher likelihood of hospitalization. According to the CDC, seniors over age 65 are 4 times more likely to be hospitalized from foodborne illness than younger adults. Recovery also takes longer, and complications are more severe, especially if the infection spreads. 4. Impaired liver and kidney function. These organs help filter toxins and fight infection. In seniors, liver detoxification slows and kidney function often declines, making it harder to recover from even mild foodborne illness. A simple egg or undercooked burger might not seem like a threat, but for someone over 65, it could lead to days in the hospital. Cooking your food thoroughly is one of the easiest and most powerful ways to protect your health every day. 7. High-fat dairy products. Many seniors grew up drinking whole milk, spreading butter on toast, or enjoying rich ice cream as a treat. But as we age, these familiar high-fat dairy products can quietly contribute to serious health risks, especially to the heart, cholesterol levels, and weight. Even though dairy can be an important source of calcium and vitamin D, the type of dairy we consume makes a big difference. Why high-fat dairy is risky for seniors. High-fat dairy contains saturated fat, which raises LDL cholesterol, the bad kind. Over time, this contributes to plaque buildup in arteries, leading to heart disease, stroke, and high blood pressure. Seniors are especially vulnerable because their arteries naturally become less flexible with age. Let's explore the specific risks. 1. Increases LDL, bad. Cholesterol. Saturated fat in butter, whole milk, and full-fat cheese raises LDL, which clogs arteries and leads to atherosclerosis. Seniors already face age-related hardening of the arteries, so excess cholesterol is especially dangerous. 2. Raises risk of heart disease and stroke. High intake of saturated fats is linked to increased risk of heart attack, stroke, and congestive heart failure. Older adults with diabetes, hypertension, or a family history of heart disease are even more at risk. 3. Weight gain and obesity. High-fat dairy is calorie-dense, and consuming it regularly can lead to unwanted weight gain. Obesity in seniors is linked to increased risk of osteoarthritis, type 2 diabetes, mobility issues, sleep apnea. 4. Digestive discomfort. Many seniors become lactose intolerant with age. High-fat dairy can cause gas and bloating, stomach cramps, diarrhea, or constipation. Many seniors don't even realize their discomfort is from dairy. They just think it's part of aging. But often, switching to lower fat or lactose-free options can make a huge difference. 8. Excessive caffeine. Caffeine is the world's most popular stimulant, found in coffee, tea, soft drinks, energy drinks, and even chocolate. For many seniors, that morning cup of coffee is a cherished daily ritual. But consuming too much caffeine, especially later in life, can lead to serious health complications, particularly for those with heart issues, sleep disorders, or sensitive nervous systems. Let's break down how excessive caffeine affects the aging body and what seniors need to know. Why excess caffeine is risky for seniors. As we age, our bodies metabolize caffeine more slowly. What might have once been a harmless pick-me-up can now cause restlessness, irregular heartbeat, or even trigger confusion or agitation, especially in those with cognitive issues. Here's how caffeine can affect older adults. 1. Disturbed sleep cycles. Seniors often already struggle with falling or staying asleep due to age-related changes in circadian rhythm. Caffeine can reduce total sleep time, decrease deep sleep, and delay the ability to fall asleep, even if consumed in the early afternoon. Poor sleep contributes to memory loss, fatigue, and falls, worsening of mental health like anxiety or depression. Fact, studies show caffeine stays in older adult systems for up to 12 hours, much longer than in younger people. 2. Increased heart risks. Caffeine is a known cardiac stimulant. It can raise heart rate, increase blood pressure, and cause palpitations, especially in people with existing heart conditions or on certain medications. For seniors with arrhythmia, irregular heartbeat, or a history of hypertension, excess caffeine may be dangerous. 3. Digestive discomfort and bone health. Caffeine is acidic and can irritate the stomach lining, worsening acid reflux, indigestion, and gastric ulcers, which are common in seniors. It also acts as a diuretic, increasing urination and possibly contributing to dehydration and loss of calcium in bones, raising the risk of osteoporosis. 4. Anxiety, jitters, and mental confusion. High caffeine intake is associated with nervousness, tremors, and in some cases mild cognitive disturbances in sensitive seniors. In people with dementia or Alzheimer's disease, excess caffeine can increase agitation, confusion, or worsen sundowning. Late-day confusion. 9. Refined carbs and white flour. These spike blood sugar and contribute to insulin resistance, weight gain, and fatigue. Examples: White bread, white rice, sugary cereal, better choices, whole grains like brown rice, oatmeal, and multigrain bread. 10. Artificial sweeteners and additives. While marketed as diet products, artificial sweeteners may harm gut health and increase sugar cravings. Examples: diet sodas, sugar-free gum, packaged low-fat snacks. Health tip: use natural sweeteners like stevia, honey, or dates in moderation. Thank you for watching. If you found this helpful, please like, subscribe, and share with loved ones. Your health is your wealth, and it's never too late to make a change for the better.